What if I told you that the little pill you've been popping for your knee pain, your backache, your arthritis, could be quietly damaging your heart every single time you take it? I'm not talking about some exotic medication. I'm talking about something you probably have in your medicine cabinet right now, something you can buy at any grocery store, something your doctor has probably recommended dozens of times. A study published in the British Medical Journal found that taking this common medication increases your risk of heart attack by 31%. And for people over 65, that number climbs even higher. Yet despite this evidence, despite these warnings sitting right there in medical journals, millions of seniors take this pill every single day. Some take it multiple times a day, and many of them have no idea what it's doing to their cardiovascular system. I'm Dr. Evelyn Moore. I've been practicing internal medicine for over 23 years, and I've specialized in treating older adults for most of my career. I've seen the consequences of this medication firsthand. I've held the hands of patients who had no idea their pain reliever was setting them up for a cardiac event, and I've made it my mission to make sure you don't become one of those statistics. By the end of this video, you're going to know exactly which medication I'm talking about, why it's so dangerous for your heart, and most importantly, what you can do instead. I'm also going to give you the exact questions to ask your doctor at your next appointment, questions that could literally save your life. But before I reveal which medication we're talking about, I need you to understand something crucial. I need you to understand how your cardiovascular system changes as you age, because without this knowledge, you won't truly grasp why this pill is so dangerous for you specifically. And to help you understand that, I need to tell you about a patient I'll never forget. Her name was Margaret. She was 72 years old when I first met her, and she had the most infectious laugh I've ever heard. Margaret had been a piano teacher for 45 years. She still gave lessons 3 days a week, and she told me that music kept her young. Her students adored her. Her grandchildren adored her. Her husband of 51 years, Richard, absolutely adored her. Margaret came to see me because she was having some mild knee pain, nothing dramatic. She described it as a nagging ache that bothered her when she climbed stairs or sat at the piano for too long. She'd been dealing with it for about 6 months, and she finally decided to mention it to her primary care doctor. He did exactly what most doctors would do. He told her to take an over-the-counter anti-inflammatory. Specifically, he recommended she take it twice a day, every day, to manage the inflammation. Margaret was a good patient. She did exactly what her doctor told her. She went to the pharmacy, bought a big bottle of this medication, and started taking it religiously, morning and evening, like clockwork, for 6 months. I met Margaret not because of her knee pain. I met her in the cardiac unit of our hospital, 3 days after she suffered a heart attack. When I walked into her room, she looked confused. She kept saying to me, "Dr. Moore, I don't understand. I've never had heart problems. My cholesterol is fine. I don't smoke. I walk every day. How did this happen?" I sat down next to her bed. I looked at her medication list, and there it was, that little pill, taken twice daily for 6 months. "Margaret," I said, "tell me about this medication. When did you start taking it?" She explained everything. The knee pain, the doctor's recommendation, her diligent compliance. She had no idea. None. She thought she was just treating a little arthritis. She thought she was being responsible by following her doctor's orders. "But Dr. Moore," she said, and I can still hear the tremor in her voice, "it's just an anti-inflammatory. Everyone takes it. My husband takes it. My sister takes it. Are you telling me that caused my heart attack?" I couldn't tell her it definitively caused her heart attack. Medicine doesn't work that way. But I could tell her that it was a significant risk factor that nobody had warned her about. I could tell her that if she had known, she might have made different choices. She might have tried physical therapy first. She might have explored other options. She might not have been lying in that hospital bed. Margaret recovered. She was one of the lucky ones, but she never played piano quite the same way again. The heart attack left her with reduced stamina, and she had to cut back her teaching schedule. Richard told me later that something in her dimmed after that experience. The fear of another cardiac event followed her everywhere. Now, I need you to do something for me right now. If you've ever taken pain medication regularly, whether it was prescribed or over the counter, I want you to drop a comment below. Tell me how long you took it and whether anyone ever warned you about the heart risks. I'm collecting these stories because I think it's important for people to know they're not alone, and because I want to show doctors and researchers just how common this knowledge gap really is. Let me explain what's happening inside your body when you take these medications, because once you understand the mechanism, you'll never look at that pill bottle the same way again. The medications I'm talking about are called NSAIDs. That stands for non-steroidal anti-inflammatory drugs. You know them by their brand names: ibuprofen, naproxen, and many, many others. They're in almost every medicine cabinet. They're handed out like candy, and they work brilliantly for reducing pain and inflammation in the short term. Here's the problem. NSAIDs work by blocking enzymes called COX-1 and COX-2. When you block these enzymes, you reduce inflammation. Great, right? But these same enzymes do something else that's critically important. They help produce substances called prostacyclins, which keep your blood vessels relaxed and prevent blood clots from forming. Think of your blood vessels like garden hoses. When they're working properly, they're flexible and smooth inside. Blood flows through them easily, like water through a hose. Prostacyclins help keep those hoses flexible and keep the water flowing smoothly. Now imagine what happens when you reduce prostacyclin production. Those garden hoses start to stiffen up. The smooth lining inside starts to get a little rough. And blood, which normally flows freely, starts to get sticky. It wants to clump together. It wants to form clots. For a young person with pristine blood vessels, this might not matter much. Their cardiovascular system has enough reserve capacity to handle a little extra stress. But for someone over 65, whose blood vessels have already experienced decades of wear and tear, this is like adding gasoline to a smoldering fire. There's another mechanism at play here, and this one is even more insidious. NSAIDs cause your body to retain sodium and water. They interfere with how your kidneys regulate fluid balance. For most young people, this is barely noticeable, but for seniors, especially those with any degree of heart weakness, this fluid retention can push an already strained heart over the edge. Let me give you an analogy. Imagine your heart is a pump. For 70 years, that pump has been working hard, pushing fluid through miles of pipes. It's still functional, but it's tired. It doesn't have the same power it had at 20 or 30. Now imagine suddenly increasing the volume of fluid that pump has to move by 15 or 20%. That's what can happen when you take NSAIDs regularly. Your heart has to work harder to push more fluid through increasingly stiff pipes. And here's what makes this particularly dangerous for older adults. The changes happen gradually. You don't feel your blood pressure creeping up. You don't feel your blood getting stickier. You don't feel your heart working harder. There's no warning light on your dashboard. The first sign that something is wrong might be chest pain, or shortness of breath, or worse. Now, I promised I would share the research with you, and this is where it gets really sobering. The study I mentioned at the beginning of this video was a massive analysis published in the British Medical Journal. Researchers looked at data from over 10 million patients. 10 million. They found that people who used NSAIDs had a 31% increased risk of heart attack compared to people who didn't use them. But here's the part that shocked me when I first read it. The increased risk wasn't just for people who took these medications for months or years. The risk was elevated within the first week of use, and it remained elevated for as long as people continued taking the medication. Another study, published in the European Heart Journal, found that the cardiovascular risk was particularly pronounced in people over 65. Seniors who regularly used NSAIDs had a significantly higher rate of heart failure, heart attacks, and strokes. The researchers concluded, and I'm paraphrasing here, that the risks of these medications in older populations may outweigh the benefits for many common conditions. The American Heart Association has issued warnings about NSAID use in people with cardiovascular disease or risk factors. They recommend that these medications be used at the lowest effective dose for the shortest possible duration. Yet somehow this message hasn't reached most patients. Most seniors I talk to have never heard this warning. They've never been told to limit their use. They've never been given alternatives. Think about that for a moment. We have major medical organizations issuing warnings. We have studies with millions of participants showing clear risks. And yet, these pills remain one of the most commonly used medications among older adults. Something in our healthcare system has broken down. Let me tell you about 3 more patients, because I think their stories illustrate just how widespread this problem is and how differently it can manifest. Robert was 68, a retired electrician who loved woodworking. He'd been taking an NSAID every day for about 2 years to manage chronic back pain from decades of physical labor. He came to see me because he was noticing his ankles were swollen by the end of the day, and he was getting winded climbing the stairs to his workshop. "It's probably just age," he told me. "Everything falls apart eventually, right?" I examined him and ran some tests. Robert was in early heart failure. His heart, stressed by years of NSAID use, wasn't pumping efficiently anymore. Fluid was building up in his legs and lungs. When I explained the connection to his pain medication, he looked at me like I'd told him his morning coffee was poisoning him. "But my doctor gave it to me," he said. "He knew I was taking it. He never said anything." We took Robert off the NSAIDs and put him on a heart failure medication regimen. We worked with a physical therapist to find other ways to manage his back pain. 6 months later, his heart function had improved significantly. Not back to normal, but better. The damage was partially reversible because we caught it in time. Then there was Patricia, 74, who'd been taking NSAIDs for her rheumatoid arthritis for nearly a decade. She'd been told she needed them to control her inflammation. She had no history of heart disease, no warning signs. One morning, her husband found her collapsed in the kitchen. She'd suffered a massive stroke. The blood clot that traveled to her brain formed in blood that had become too prone to clotting, in vessels that had become too stiff, over years of daily NSAID use. Patricia survived, but she lost the use of her left side. She can no longer live independently. Her husband, 81 himself, became her full-time caregiver overnight. And then there was George. George was my patient for 15 years. He was a former high school history teacher, sharp as a tack, with an encyclopedic knowledge of every major historical event. He took NSAIDs occasionally, maybe a few times a month when his osteoarthritis flared up. Not daily, not even weekly most of the time. He thought he was being careful. But George also had early-stage kidney disease that he didn't know about. Many seniors have some degree of kidney function decline. It's an almost universal part of aging. NSAIDs are processed through the kidneys. When your kidney function is reduced, these medications can accumulate in your system and have amplified effects. George had a heart attack at 79. It wasn't massive. He recovered well. But when we reviewed everything, the occasional NSAIDs combined with his undiagnosed kidney issues had created a perfect storm. These 3 stories represent 3 different patterns I see all the time. Robert, the daily user who developed heart failure gradually. Patricia, the long-term user who had a sudden catastrophic event. And George, the occasional user whose other health factors amplified his risk. All 3 outcomes were preventable. All 3 patients wish someone had warned them sooner. I want to pause here and ask you something else. If you're watching this video and you're over 60, I want you to comment below and tell me whether your doctor has ever discussed the heart risks of anti-inflammatory medications with you. Have they ever suggested limiting your use? Have they ever offered alternatives? I really want to know, because your answers help me understand how we can do better as a medical community. Now let me give you some practical guidance, because I know you're wondering what you should actually do with this information. First and foremost, please do not stop any medication without talking to your doctor first. That disclaimer is crucial, and I mean it sincerely. If you're taking NSAIDs for a serious inflammatory condition, there may be important reasons for that choice. This video is meant to inform you, not to override your personal medical care. That said, here is what I recommend you discuss with your healthcare provider at your next appointment. Step 1. Ask specifically about your cardiovascular risk. Say something like this: "Doctor, I've been taking anti-inflammatory medications, and I recently learned they can increase heart attack and stroke risk in older adults. Can we review whether this is the safest option for me? Any good doctor will appreciate that you're asking informed questions about your care. Step 2. Ask about your kidney function. Request a simple blood test called a basic metabolic panel if you haven't had one recently. This will show your creatinine level and estimated kidney function. If your kidneys aren't working at full capacity, NSAID risks are amplified significantly. Step 3. Ask about alternatives. There are many other approaches to pain management that don't carry the same cardiovascular risks. Acetaminophen, for example, works differently and doesn't affect your heart and blood vessels the same way. Physical therapy can address the underlying causes of pain rather than just masking symptoms. Topical treatments deliver medication directly to the painful area without as much systemic absorption, and for some conditions, there are other medication classes that may be more appropriate. Step 4. If you must use NSAIDs, discuss the lowest possible dose for the shortest possible time. The research shows that risk increases with both dose and duration. Taking a high dose every day for months is very different from taking a low dose occasionally for a few days. Step 5. Know the warning signs. If you're taking these medications and you develop any of the following, seek medical attention promptly. Unexplained shortness of breath, swelling in your ankles or legs, chest pain or pressure, sudden severe headache, sudden difficulty speaking, or weakness on one side of your body. These could be signs that your cardiovascular system is under stress. Step 6. Consider asking about cardiovascular monitoring. If you absolutely need to take NSAIDs regularly for a chronic condition, discuss whether you should have more frequent blood pressure checks, kidney function tests, or other monitoring to catch problems early. I also want to address something I hear from patients all the time. But Dr. Moore, I've been taking these for years and I'm fine. That may be true. Not everyone who takes NSAIDs will have a heart attack or stroke. It's about probability, not certainty. But consider this. You also know people who smoked for decades and never got lung cancer. That doesn't mean smoking is safe. It means they got lucky. And with NSAIDs, just like with smoking, the risk accumulates over time. The fact that nothing has happened yet doesn't mean the damage isn't occurring beneath the surface. Let me also address the other side of this. Pain is real. Chronic pain affects quality of life. It affects mental health. It affects relationships and independence. I am absolutely not suggesting that you should simply suffer without treatment. What I am suggesting is that the treatment should be chosen with full awareness of both benefits and risks, and that for many seniors, there are better options available that their doctors may not have mentioned. I think about Margaret often. That piano teacher with the infectious laugh, she's doing okay now. She and Richard celebrated their 55th wedding anniversary last year. She sent me a card with a photo of them together, but I also know that she takes a handful of heart medications every day now. She worries every time she feels a flutter in her chest. She gave up teaching entirely because the stress was too much. When I showed her the research about NSAIDs and heart risk, she cried. Not because she was angry, though she had every right to be. She cried because she wished she had known. She wished someone had taken 30 seconds to warn her about the risks before she started taking that medication every day for 6 months. That's why I make these videos. That's why I'm talking to you right now. Because you deserve to know what Margaret didn't know. You deserve to make informed choices about your health. You deserve a doctor who treats you like a partner in your care, not just a patient who follows orders without question. If this information was valuable to you, I need you to do 3 things for me. First, hit that subscribe button and the notification bell. I release new videos every week about health topics that matter for people over 50, and I don't want you to miss any of them. Second, share this video with someone you love, your spouse, your sibling, your best friend from high school, anyone in your life who might be taking these medications without knowing the risks. You could literally save their life by sending them this link. And third, leave a comment telling me what health topics you want me to cover next. Your questions and concerns drive my content, and I read every single comment. Next week, I'm going to talk about another medication that millions of seniors take every day, one that can silently rob you of essential nutrients your body needs. If you think the NSAID story was eye-opening, wait until you hear about this one. Remember, your health is your most precious asset. It's worth asking questions. It's worth demanding answers. It's worth being an informed patient who advocates for yourself. And if your doctor doesn't take your concerns seriously, it might be time to find a doctor who will. Before I go, I want to say this directly to you. Please consult with your healthcare provider before making any changes to your medication regimen. This video is intended to educate and inform, not to replace personalized medical advice. Every person's situation is unique, and what's right for one patient may not be right for another. Thank you for spending this time with me today. Thank you for caring about your health enough to learn something new, and thank you for trusting me to be part of your health journey. This is Dr. Evelyn Moore, reminding you that it's never too late to take control of your health. I'll see you in the next video.